Would you like a second opinion on your diagnosis? Please send your analysis and medical history to visite@qs24.tv, and our Chief of Medicine, Dr. Wiechel, will analyse them for free and anonymously in our new series Ward Round. For more information, visit qs24.tv. Welcome to our new episode of Ward Round. And thank you very much for all your questions. I was allowed to choose a couple of them from this abundance, and also I noticed a gentleman born in 1956 suffering from herpes encephalitis. That is encephalitis based on herpes viruses, and maybe it's interesting to even talk about viruses at that point in order to understand what an inflammability on a viral basis is signalling to us, or how to treat it. And this patient has been treated with antivirostatics in combination with high-dose antibiotics. Although antibiotics are always directed against bacteria and never against viruses. He now sent me his documents for me to assess his case, and I would like to explain it to you. How we as humans are contaminated by viruses. They belong to us, like Jesus to Mary, so viruses are part of human life. And the life of mammals, due to evolution. There are intracellular protein complexes that only have been made visible and were named in the context of the presentation of the electron microscope at the beginning of the 20th century. You could already detect bacteria in the 19th century. And they didn't know a name, so it was named virus. That is a toxin intracellularly. There, the viruses are part of the cell. And there is always a necessary prerequisite which brings these viruses into a reactivity, which then of course disrupts the cells in its metabolism and also provokes inflammation. When we go through chickenpox as children, then this chickenpox disease is a childhood disease. And we are very, very, very interested, we as doctors, that if a child has chickenpox at home, that the sibling slips into bed with them, so that these siblings are both going through chickenpox. These are limit value experiences of children, or rather, they now also penetrate the limits of life. They are children, and through chickenpox, they are pretty much challenged. It itches, it burns, depending on how generalised these chickenpox are. These children may take quite a development spurt as part of this children's disease, and you have to pay attention. Suddenly the little ones go to the potty, suddenly they start babbling. These are incredible processes which positively result from the context of such a childhood disease. These chickenpox viruses then revert to inactivity. The body has learned to develop antibodies, which can also be proven, and with every reactivation it is available and can treat this secondary chickenpox disease right away and unnoticed. The chickenpox viruses have their affinity for the spinal cord, and there they are calm and warm and inactive. And when our life is in good balance, we actually no longer have an issue with that. But whenever we get a secondary hit, so now it's about our immune capacity, and that can be, for example, when you are chronically lacking zinc, then you have less and less the possibility of realising an intracellular exposure inactively. When you experience a shock, you automatically bring your immune system to zero. If you're in a car accident or you're going through a difficult time in life, the situation after losing a child, or something similar, whenever the immune capacity drops, the likelihood of a viral reactivation can increase. The secondary disease of this chickenpox disease is not called chickenpox though, but shingles. And wherever the chickenpox virus was inactive, it spreads. When the chickenpox viruses, they are now called varicella zoster, are getting out of the skin really dramatically, it's always a good thing. That means, of course, you also need to cover it locally, which you can do very nicely with zinc or baby powder, or even just with flour. But it's always good if it comes out. If that doesn't come out, then you will have girdle-like dramatic nerve pain. And one of the most dramatic secondary illnesses is actually always the postherpetic neuralgia, so the inflammability of these nerves afterwards. I have to tell you that too, who now had this herpes zoster encephalitis because you only reacted against a virus. In other words, it was an attack on the virus. But that is not the cause. The cause must be a burden, which you do not know yet and which has not been investigated if I look at these documents. When I was a young doctor and had the first patient with herpes zoster, if I gave him an antivirostatic, that's how I had learned it. I gave it 2 days, then the patient came. He could no longer take it due to the side effects. That was my first and last medication. Since then, I have been concerned with why this can develop at all and what does it need now. And the first thing is really to sort out what happened. Because if nothing has happened, then it is a weakness on another level that has arisen, and it really has to be called by name. The best way to do this is to have an immune status. You can see exactly which immune fractions are not working optimally here. The other is that, for example, the viruses are now being reactivated. They can no longer multiply. If you consume L-lysine, a valuable amino acid, that prevents that. You can take from 500 milligrams up to 2,000 milligrams, temporarily, when this reactivated herpes disease is there. The other thing is high-dose vitamin C. You can slowly release vitamin C in a buffered manner. That is the CTB in Germany. There are also other depot supplements internationally. You can take 500 milligrams 3 times a day, that's 1,500. More than that doesn't make sense because then it will be eliminated. But you can also get 7 grams of vitamin C infused. That would now be for a herpes disease, the most valuable measure, also even 15 grams. If you go higher, you have to have the glucose 6-phosphate dehydrogenase measured, because if you go higher with the vitamin C doses, it can cause kidney stones. And if you have a good, powerful enzyme, you don't need to worry about that. We infuse up to 80 grams, sometimes up to 90 grams for tumour patients. It is very important that you remember herpes viruses are brought into inactivity by zinc. And I see zinc almost 30, 40, 50%. And more of our patients are zinc deficient. You can have the zinc level as a laboratory value in whole blood, and then you can buy zinc with 15 milligrams. And according to the result of this value, and also in the knowledge that only 30% is reabsorbed by the intestine, take some zinc, really 30, 45 or 60 milligrams. Sometimes it has to be 100 temporarily, but the process needs that, otherwise you cannot lead the viruses back into inactivity. Herpes viruses are part of our life, but they are viruses. And sometimes also really skin viruses. They can also inflame neurological nerves. The viruses must be brought back into inactivity. You can't destroy them, that is out of the question. Because they live in a symbiosis with us, and they also have challenged our immune system for millions of years. That this guardian angel immune system protects us incredibly from almost everything. It is only ever a problem when your capacity is weakened and when it is overwhelmed. And a fourth therapeutically valuable measure is that there is the company Labolife in Belgium. They make drugs or dietary supplements that are not homeopathic but have a homeopathic dose and which carry the whole immune fractions. There would be the 2L herp for the herpes simplex viruses or 2L zona for the herpes zoster viruses. But this needs an extra training of doctors. They must also be capable of microimmunotherapy, and you can go through the Society for Microimmunotherapy. You can find out where the next microimmunotherapist is in your area, and thus start an immunological training process for your immune system to better withstand a new viral developing reactivated herpes strain. Or it doesn't get to that anymore. But what is very important for all of you too, that in the event of viral concerns, the base is always high doses of vitamin C, zinc and L-lysine. In this trilogy, in combination of course with vitamin D, if you reactivate a herpes virus, you can't be in equilibrium with your vitamin D value. I would ask you to check that too before winter, and to take a very good supply of vitamin D daily on the basis of oil. But I hardly ever experience a person who takes less than 4,000 units per day in the combination with 100 milligrams of vitamin K to get through the winter really well. Vitamin D controls 100,000 immune reactions. And don't underestimate it. It's the most important hormone for any cellular health, and we have 600 trillion of those. That's what I would like to say about this clinical picture. This herpes encephalitis, medically and symptomatically, there has been done a lot, but that should really get all your alarm bells ringing. Also to look for the causes, how this reactivation could even develop. And maybe that can be an issue again. But you will also notice that when a biological doctor gives advice, it is always actually elementary things that lead to a disease, and of course you can never ignore it, and you have to make people aware that a disease, it is like the second act in the theatre. The disease was always the first. That means every inflammation, every derailment is only developing when the body has lost the strength to regulate accordingly. And if you take the time, if it is important to you, if you also want to understand the causes, then it is really necessary at this point to ask questions and also to find answers. So that something like that does not repeat itself, or else that you are armed completely for different things as well, and that's what we're equipped for. So you can really trust this immune system. As part of this Ward Round episode, I can answer another question. And that is a question of a married couple out of concern that the husband may have a slight hand tremor. Now, I have to tell you, when you hear tremor, you hear very quickly too that then idiopathic tremor is diagnosed. Perhaps because of the non-complexity of the clinical picture, one would refrain from diagnosing Parkinson's, but with the observation and the course, I see very, very many patients who tend to develop neurodegenerative diseases. And of course, observe things a long time in advance, including a tremor that may never even tend toward it, but it is a sign of a completely different disorder. And that is why it is so important when you actually verify this tremor, this quiet tremble, whether small or large, also one-sided, that you then, of course, start a diagnosis that enables you to help the body on this level. This is, of course, the first thing that you have to exclude here as well, that the patient has an open blood-brain barrier. And an open blood-brain barrier would mean that any toxic load reaches the brain as well. And of course, it also has a neurotoxic effect on the areas that produce dopamine, for example. That is the neurotransmitter who can be partly responsible for a tremor. That is a value, it is the S100 that can be examined and thus indirectly has an indication on the open blood-brain barrier. The other is that you also have to rule out a leaky gut, because the intestinal permeability syndrome that perhaps preceded this illness a long time unnoticed also causes inflammation processes at the blood-brain barrier. So via the vagus nerve, the guide rails between gut and brain, you transfer inflammation upwards. And please have this examined urgently. To what extent the bowel is in good health? I don't know any tumour patient, no Parkinson's, no MS, no rheumatism patients, which have a very balanced, good, powerful and intact bowel function. And all of these people don't come with a bowel problem. They can actually talk about it quite freely by saying, no, this biological clock is ticking, and still you come across things which were the prerequisite when the body was overwhelmed. The liver was overwhelmed, and this neurodegeneration has arisen slowly. It is very important that you rule that out. A stool analysis, there are various laboratories in Germany that will do a large stool analysis and determine, among other things, the calprotectin, the secretory IgA for the performance of the immune barrier, the alpha antitrypsin for inflammability, and also the zonulin. These are crucial findings that you need to know here. The second is that the thought must also be if the liver is overloaded with copper. This is the so-called Wilson's disease. It can cause a Parkinson's-like problem with tremor. And then urgently have your husband measured for his need or his level of copper. You can also have the detoxification capacity of the liver measured, because that's what matters. Without the cofactors, for a good detoxification, without enough glutathione, without enough essential amino acids, without adequate detoxification enzymes, you can't expect your husband to withstand stress for less time than you. And those are crucial things that really come to light through a heavy metal test. Whether there are neurotoxins involved that maintain this tremor. What we have already experienced is also, and I'm going back to the work of Hanna Balova, who is a great parasitologist in Slovakia, so she has always attached importance to looking for parasites. Parasites in the form of echinococcal cysts, parasites that encapsulate and then localise areas in the segment of the spine, which, for example, only care for the right arm, and then trigger a small, coarse tremor. And she once again trimmed my focus and my gaze so as not to overlook these things. If it only affects the left arm or only the right leg, this can be elsewhere. But with the parasitic loads, you now, of course, have to know much more about the person. Have they been abroad? Do they eat sushi? Do they live with cats and dogs? It's all very important, and you can actually hardly detect a parasitic load in the stool. These are examinations, a stool sample 3 days in a row. And if you're 3 times negative, the parasite diagnosis is off the table. No, that is not true. So parasites speak the language of neurotransmitters. This means that parasites can get involved in these processes and also maintain these processes. And the diagnostics are carried out with us via a salvium machine, which is a bioresonance device. But electroacupuncture can also rule this out very well. And that too is a very important aspect here, to investigate why this tremor is maintained. There are, of course, more big questions. To what extent was there perhaps a cervical spine trauma in the past, whiplash injuries? That is often the case. The head is torn from its basic position, and it is not a rubber band that then just swings back. But these are instabilities that can last for a lifetime. The problem is that through this cervical irritation, the circulation as well as the neurogenic, so the nervous connection between head and body, can be, of course, restricted irritatingly. And that also needs to be looked at. The so-called nitrosative stress is measured here via the urine and can lead indirectly to a statement to what extent there is a so-called nitrosative stress problem, which of course also has an impact on the cellular level. Bodo Kuklinski from Rostock has just written a really great book about mitochondrial disorders or cervical spine syndrome as well. But he dedicated, I think, 6 pages in the book only to various symptoms of diseases that originate due to this fact at the cellular or organ level in the first place. And that too has to be clarified here. And not just a CT while lying down, for example, but also while sitting, so that you can easily see what is happening in everyday life. Is there still 100% communication in that direction? These are all thoughts that are, of course, necessary to really clarify in order to then gradually take the steps that are needed. And so, to summarise again, have the bowel examined thoroughly, and please do not through a colonoscopy, because just by looking in, the human eye cannot even perceive it. This is about functional processes that you analyse from a stool sample. That's the big stool check, and then you can quickly get 10 answers to 10 questions. The toxic question must be clarified. The neck instability or stability must be queried. The viral reactivation, inactivation. The functional detoxification capacity of the liver. And in the end, I forgot, No holistic diagnostics can be done without a tooth OPT, a panorama picture of the teeth. Because 70 to 80% of all diseases first find their cause here. And that needs to be done by a holistic dentist who thinks far beyond this level. And also, in the context of a tremor, can quickly find a reference to the remote reaction due to a tooth instability, but also so-called neco-inflammation centres, impacted wisdom teeth, and much, much more have to be taken responsibly into his hands now. Thank you very much for your attention. And I'm already looking forward to next Sunday. All the best. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.